Well, good afternoon, everyone. I'd like to take a moment to welcome you to this webinar that's being put on jointly by the Association of Indiana Counties, partnering with us, ICE Miller. I am Tammy Earnhardt. I'm an attorney in our labor and employment group, and I have been spending probably the last 3 to 4 weeks of my life talking about coronavirus or COVID-19 related issues that are affecting employers and the various challenges that have occurred across both public and private entities in addressing the virus and the impact on the workforce. And so today we are going to talk a bit about the Families First Coronavirus Response Act. I do have some pre-submitted questions from some of you, and we will get to those. The goal is to speak hopefully for, 30 minutes to 40 minutes, and then take the rest of the time for questions. So if you have questions and you want to put them in the Q&A box on your screen, since we don't have live mics for everybody, everybody's muted, that would be helpful, and I will try to watch for those questions and either respond to them as I go or save them till the end, and I will try to get to as many of them as I can. So you actually are in a group of lucky few who are getting a first glimpse, I would say, through a webinar at the regulations that came out yesterday. I had to work on my presentation last night because those regulations affected some things. And to the extent that you all have already educated yourselves about the Families First Coronavirus Response Act, you're getting a large number of emails and so forth that contain information about that. It may be that some of the things you've already learned changed a bit through the new regulations. And so what I will try to do is make sure that as we talk today, I highlight some of the changes that have occurred through these regulations. So without further ado, I'll just start giving you some background. I wanted to make sure everybody knew where we were. We're constantly or regularly getting guidance on the leave requirements under the Act. And as I said, as of yesterday, we received what are called the temporary final regulations. When I first saw it, I thought, temporary final regulations, does that mean there's going to be permanent final regulations? And when I thought about that some more, I thought, well, this is a temporary law. So they probably don't want to have something called final regulations out there because they're going to go away. But by the same token, it is possible that the regulations will change. So we're going to work with what we have right now. They were just issued. If I talk about a particular part of the regulations and say, I'm still analyzing that, it's because, there are 124 pages and I didn't get a chance to go through them in great detail. Well, I did, but there's still some complicated parts of it. So let me just give that little disclaimer. We have some documents from the Department of Labor with multiple fact sheets. We have questions and answers from the Department of Labor. That was also updated yesterday. You may not have known that if you're monitoring the questions and answers because there's no new numbers, at least the last I checked, there were no new numbers on the questions and answers. Instead, what the Department of Labor has been doing is they've been changing the answers and not necessarily highlighting the changes, saying, oh, by the way, this is new. So what they've done is gone back and changed the answers in a way that actually matches the regulation. So that was interesting to see that happening in the background. We have a poster. If you haven't seen the poster, you want to get the poster. It is available to you on the Department of Labor website. They have a specific website that's related to COVID-19, as almost every agency, law firm, accounting firm does right now. But you can get the poster and use that as your posting to notify your employees about the availability of these leaves. It's a required posting for all employers that are covered by the Act. The regulations did provide the ability for employers to post their own posters. And so if you don't like the poster, the way it looks or the way it reads, and I'm particularly attuned to the way it reads, because it could be seen as a little bit confusing at points. You can do your own poster as long as you include the same information, including how to get a hold of the Department of Labor and make a complaint. When were these laws effective? This is something that, although we all know that they're effective April 1, yesterday, and go through December 31st, the question that often comes up is whether the law is retroactive and whether the leave that the employer provided prior to April 1 counts towards the required leave for these particular laws, and the answer is no, it doesn't. If you were providing any form of paid leave to your employees who were affected by this prior to April 1, kudos to you, and that's wonderful that you're helping your employees, but you still get to provide them with the full leave that is required under the Act as of April 1. What employers are covered? Well, private employers have this fun analysis they have to do about whether they have fewer than 500 employees. But those of you on the phone don't need to deal with that. You just need to know that you're covered. Public agencies are covered. I probably should say agencies on my slide, but public employers. That includes political subdivisions of the state, which includes counties. So it doesn't matter how many employees you have, you're covered. That's pretty simple. Makes it easy on you, but also has its own tricks to it, of course. But that's the same as the old FMLA, for example, or the traditional FMLA. You were all covered by that too. There's a small employer exemption, and I'm mentioning it here only because in the regulations they don't say it only applies to private employers. So it's kind of interesting. And so I was told in a webinar that my carrot might be going the wrong direction. I'm not sure if I've just forgotten my math symbols, but it's supposed to be less than 50 employees. And then there's this test about viability of a business as an ongoing concern, which doesn't make sense for public agencies. So my guess is that although they didn't specify in the regulations that this doesn't apply to public agencies, it likely doesn't because that analysis really cannot be done. However, there's this part of the criteria that is important, I think, in some ways to you all, because to the extent that an employee requests leave and it actually causes you to be unable to provide the services that you provide at a minimal level, and that's what these tests are, the small employer exemption would apply to employers that have this concept of a going concern. Again, I'm mentioning it because you may hear about it. I don't think it applies to your agencies because of the language that's used in it. You don't have the business revenues or financial obligation and so forth, but the regulations don't distinguish and say that this only applies to private agents or to private employers. There are two forms of leave provided under the Families First Coronavirus Response Act. I want to go through both of them so that we get a general understanding of the parameters of each. And again, I'll try to focus on those areas that I think I've been getting the most questions from employers and may cause you to wonder how you're supposed to be applying it. So this expanded FMLA, or public health emergency leave, is the biggest bucket. And it's only, I call it that because it's the longest. It's not actually the most valuable monetarily to employees, but it is the longest period of time that somebody can take off. This applies to all employees who have worked for 30 days for you. So anybody who's worked 30 days prior to the need for leave is eligible for this kind of emergency leave. So when you've been applying the traditional FMLA, you've been thinking about somebody who's been working with you for 12 months, 1,250 hours. That doesn't apply here. It's simply a 30-day test. There was a provision added to this by the CARES Act that was passed last week, and that included employees, it included the definition, employees who were laid off or terminated after March 31st, who are then rehired. So within this period of March 1st, I'm saying it wrong, March 1st through December 31st, if you have laid off or terminated an employee and then they're rehired, they're immediately eligible for leave under this the expanded FMLA leave, as long as they've been, and this is in the regulations, as long as they've been on your payroll for 30 days in the prior 60 days before they were laid off or terminated. It's a little bit confusing, but you look back and say, were they already employed by me for 30 days when I laid off or terminated them? If so, when I hire them back, they're automatically eligible for this leave. There are exclusions permitted, and these are exclusions permitted from the definition of an employee, not the definition of an employer, that relate to healthcare and emergency responders. The healthcare part of this was recently expanded both by the Q&As from the Department of Labor and the regulations. And for your purposes, I think the most important specific entity on that list is the local health department or agency. So what this particular exclusion, it includes doctor's offices, it includes hospitals, it includes, the whole gamut of what you might think of as a healthcare provider. And I would say it's human healthcare providers. It doesn't include veterinarians or things like that. But this is an exclusion that can be taken by an entity that is a healthcare provider, is allowed to exclude all of their employees, even if they're not actually acting in the role of a healthcare provider. So you have likely an employee or so, or many of you do, that have probably meet the definition of a healthcare provider or emergency responder, and I'm going to go through that in a little bit more detail because I think more of those categories apply to you. According to the regulations and the Act itself, there is an exclusion for those individuals who fall within the definition. The regulations, though, were written in such a way that it almost implies that you have to exclude all of your employees if you are a healthcare provider, which might not make as much sense as it seems. So if your local health department or agency wants to exclude one employee, according to the regulations, they could exclude all employees from being eligible for this leave. There was a conversation I'm aware of with the Department of Labor here this morning even about whether you have to exclude all employees if you take advantage of this definition. And the Department of Labor officer who responded to the question said, yes, you have to exclude all employees if you take advantage of this exclusion. I'm not confident that that's the right answer. So when we call the Department of Labor, sometimes we get individuals on the phone who haven't heard the official interpretation from the top of the Department of Labor, the administrator. And so I believe that the intent was, and you can see it when I show you the emergency responder definition, the intent was to make sure that anybody that falls within these definitions, anybody who's a healthcare provider, an emergency responder, still can maintain the patient care or the emergency response services that are needed to respond to this pandemic. So sometimes the individuals who are more administrative in nature don't fall within that category. Sometimes they do. It all depends upon how vital they are to the operations of the response system or the healthcare provider system. So the emergency responder definition: anyone necessary for the provision of transport, care, healthcare, comfort, and nutrition to patients or otherwise needed for response to COVID-19. It includes law enforcement officers and correctional institutional personnel, firefighters, emergency medical service personnel, public health personnel, so it's kind of double covered there, emergency medical technicians, paramedics, emergency management, 911 operators. You can go down the list: child welfare workers, public works personnel. So there's I think, as I said, this category of potential exclusions is much more significant for those of you on the phone. You likely have more employees that fall within one of these definitions. So if the person that answered the question this morning on this email chain I've seen is right, then one of your fire departments or child welfare type agencies within your county could would have to exclude all of their employees from the leave in order to take advantage of this particular exception to the rule. If there is a different interpretation, such as one that says you can exclude those who are most vital to the provision of the services, we'll have to see that fleshed out a little bit. I can tell you that the interpretation of the statute itself seems to fall along the lines of it's an employee by employee type determination. And maybe not, maybe I'd say that too broad. It's a category of employee by employee type determination. So you might need to get some particular advice on that topic as you go along and decide whether you're excluding the particular people from this leave. I had a question whether there's a definition of public works personnel. I'm sorry, I didn't look that up beforehand. It's not in the statute and it's not in the regulations. So it would be the common definition of public works personnel, and I haven't looked that up for the state of Indiana to be able to recite that to you. But that would be something that's found within the statutory definitions. In addition, there's another category that I don't have on the screen right now, which is anybody that the highest ranking official of the state or Washington or DC, I guess, or territory decides is a emergency responder. So we could look in, and I know there are definitions of emergency responder in many statutes in Indiana, or the governor could define who an emergency responder is for these purposes too. All right, so going back to the different forms of leave, because I wanted to get that concept of you have employees that could be excluded right up front, and this concept applies to both kinds of leave. But the public health emergency leave is only available to employees when they are unable to work or telework. That's important, unable to work or telework. So that means you've given them the authority to telework, for example. You've said it's okay for you to take your work home, it's okay for you to log in remotely, here's everything to do. They would have to have something happen to them that caused them to not be able to telework with their child, their child care needs that cause them to need leave before they could take the leave. The mere fact that they're not in the office doesn't make them eligible for the leave. So unable to work or telework due to the need to care for their son or daughter if their school or place of child care is closed. The definition of son or daughter in the statute said under 18 in some places, not in all places. The Department of Labor has decided that includes everybody, that includes children who are 18 or older, if they're incapable of self-care due to a disability. I might have jumped ahead on my slide there, but I thought that was important to raise. The Department of Labor regulations that came out yesterday also say that this is only available to employees if there's no other suitable individual, such as a co-parent, co-guardian, or their usual child care provider that's available to take care of the child during a period of leave. So that's an interesting nuance for employers, because you have an employee who says, well, I'm going to just kind of take advantage of this and take a leave and get 2/3 pay. I know that my spouse is at home and could take care of them, or I know that my, an adult child care provider is there in my house, whether it be grandma or whether it be, an older brother or sister or whatever. There's somebody that's a suitable individual to care for the child is there. They may not be eligible for the leave because of this particular nuance in the regulation. A question that came in related to the EMS and Sheriff's Department, and can we exclude them and not the rest of the employees in our county? And the answer, I believe, for you is yes, because each of your different departments are seen as different functioning entities, and you should be able to, and different employers in many of these cases, right? And you should be able to make that choice on an employer by employer, entity by entity decision. So according to the regulations, I told you the son or daughter does include people who are 18 years or older if they have a disability and are incapable of self-care. the statute, there was a definition of child care provider for the purposes of this leave. And it said it was somebody who receives compensation for providing child care services on a regular basis. But then we get the regulations yesterday, and it specifically says that there's no compensation requirement. It could be a grandparent. It could be a sibling. And if that grandparent or sibling are not available, even though the employee's never paid them for child care before, but if they're not available, then the employee could take this form of leave. And I've been thinking about this particular change that the Department of Labor has provided us in the regulations. And I wonder if the reason that they put it in there was because they included that suitable individual kind of clarification. Because if there's no suitable individual available, that's when the employee can take the child care leave. And if the suitable individual could be a grandmother, and now the grandmother's not available, they didn't want the impression to be that if somebody had their grandmother taking care of them and now they don't, that the employee didn't need leave. So just thinking as we kind of process these new regulations, some of these things may make more sense to us, and some of them may not. So a school is a elementary or secondary school. That's pretty straightforward. All right. Public health emergency leave is 10 days unpaid. That's what it said in the statute. The Department of Labor says, no, it's 14 days. It's not 10 days, it's 14 days. And I think that makes sense. And because, as you all know, the FMLA gives somebody 12 weeks of leave. And this is part of the FMLA. And if it didn't mean 14 days, then we'd really be talking about less than 2 weeks. And so the statute says 10 days are unpaid, and then the remaining 10 weeks are paid at the 2/3 rate, capped at $200 per day, $10,000 in the aggregate. So in order for those two to marry up, in order for it to actually be 12 weeks, it does have to be 14 days. We were all kind of scratching our head going, well, maybe they thought that everybody works 5-day work weeks, and that's why they use 10 days. So anyway, if your employees work a variable work week, then there is a 6-month averaging requirement so that you can determine how much your employee would work on average and provide them that amount of leave in their bucket to use going forward. The regulations included some information about that averaging. That is one of those areas that I'm still trying to make sure I understand because they have some strange provisions in it. But just know that it's a 6-month averaging, and if you have employees that you feel like you need to go back and do that for, we're going to need to look closely at the regulations and make sure you're doing it right. Notice is required as soon as possible, as soon as practicable. You're used to that phrase in the FMLA, if the leave is foreseeable. The regulations say that this leave can be intermittent, but it's not required. Okay, so you can provide an individual intermittent leave for this purpose, but it's not required that you do so. It's up to you. The regulations also talk about the requirement to use other paid time off during the period that's paid at 2/3. So you think about this last 10 weeks of the leave. And they're a little bit confusing. They talk about being able to require that the employees use other paid time off during that period only. You can't require them to use other paid time off during that 2 weeks that's unpaid. But the Department of Labor and the regulations suggest that you could require it for the 2/3 pay period, that 10 weeks afterwards. I suggest that you keep an eye on that because, and as I am, frankly, because it's a little bit inconsistent in the regulations. So it's just another area to think about. So if you're in the position where you're saying, I'm going to let the employees take their time to make up for that 1/3 that they're losing, I'm going to let them take their paid time off, then great, you can let them take their paid time off. The question is whether you can force them to do it. And so before you force them to do it, just double check that you're on good standing before you do it. The requirement for a person taking leave is job restoration when they get back. You need to restore them to the same or equivalent position, unless that job would have no longer existed without the leave. And this is an important exception, particularly in this time period, because many employers are struggling trying to figure out what they're going to do with the employees that don't have any work right now. And so it's important to understand that you can have a situation where an employee who's on leave can lose their role, whether it be temporarily or permanently, as long as you're applying your selection process without considering the leave itself. So that's important, and that's why I say caution here. Make sure that you're thinking about what your criteria is for selecting somebody before you make that choice, and make sure it doesn't look like you're extending or terminating somebody because they're on leave. All right. There's another kind of exception to this job restoration for very small employers, I call it. It's employers that have fewer than 25 employees. Again, there's a question as to whether it applies to public agencies, but it's interesting because it's more onerous than that catch-all one I told you about, which is that, you know, if the job wouldn't exist and because the person would have been laid off even if they were there, that doesn't require any added steps in order to take advantage of it. This one does. It says that if the position no longer, you have to determine that the position no longer exists due to economic conditions or other changes in operating conditions, and that were caused by a public health crisis. Then you have to make reasonable efforts to restore them to an equivalent position. And if those reasonable efforts fail, you make a reasonable effort for 1 year after that to contact the employee and let them know if there's an equivalent position available. Seems a bit onerous for the very small employer when every employer can have, or at least rely upon the idea that if they would have been let go, regardless of whether they took leave, then that's okay. All right. I'm seeing some questions come in. I want to make sure that that I get to those. I think some of them are going to be cleared up by some of my presentation. So I'm going to keep going, but I'll come back to the questions at the end because I did want to leave time for those. So the emergency paid sick leave is separate from the public health emergency leave. This applies to all employees. There's no service requirement whatsoever, and they're available for immediate use. The same permissive exclusions for healthcare and emergency responders exist here. Same rules, same language. Your employees need to give you reasonable notice after 1 day. So you think about it, an employee who needs one of these kinds of leaves, if they don't tell you on the first day, they get a free pass for both of these, and they need to provide you with reasonable notice after they realize that they need it. There are job restoration rules for this kind of leave, but there's no exclusion for those small employers under 25. There are 6 reasons why somebody can take leave under this portion. I like to break them down between the employee circumstances and the care or other circumstances. It makes it easier when we get to how do they get paid. So an employee's circumstances is an absence because the employee is experiencing the symptoms of COVID-19 and seeking a medical diagnosis. That's one reason. The regulations address this, and they talk about how or what is really happening while somebody is on this type of leave for this reason. And so the employee has to have identified symptoms of COVID-19, which are defined as the fever, the cough, the shortness of breath, or any other symptom that the CDC says is related to COVID-19. If you look on the CDC webpage, there are a few other symptoms that come up. The employee has to be experiencing those symptoms or a combination of symptoms, and then they have to be actually taking steps to seek a medical diagnosis. Once they get the medical diagnosis, then they're no longer covered by this reason. Even if the medical diagnosis is COVID-19, they're no longer covered by this reason. In practical senses, what will happen is they will switch to the third reason on this slide, which is a healthcare provider is advising self-quarantine because they have COVID-19. But if they get a diagnosis of the flu, then they're no longer covered by this law. The absence also could be because the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. This one has been difficult from an application purpose because we have these shelter-in-place or stay-at-home orders. And so the regulations address this particular issue. What they say is, yeah, a shelter-in-place order, stay-at-home order is an order from a federal, state, or local government. Yeah, that's right. However, when the business or the employer is affected by that order and has to lay off or shut down because of that order, there's still no job for the employee. And the employee doesn't need to take leave because of that order. There is no job. So it's kind of interesting. And if you think about it, if the opposite were true, if the shelter-in-place or stay-at-home order, in Indiana we have stay-at-home orders, if the stay-at-home order applied and essentially said that everybody gets 2 weeks of leave, a paid leave in this circumstance, then every employer would have had to pay their employees 2 weeks of pay as of yesterday, unless they were an essential business. And I know some of your operations are still running and you all are deemed essential businesses for the most part. But yeah, it would have been an interesting dynamic to say that every employer had to pay everybody unless they were still up and running. So the order itself, in and of itself, doesn't count. But if the employee is ordered by federal, state, or local agency or official to self-quarantine themselves, then they would still be have available leave. And then the third one here is the absence because a healthcare provider has advised the employee to self-quarantine due to concerns related to COVID-19. That one was fleshed out also. That means that the employee has, they could have symptoms and the test isn't available for them. So the doctor actually says, I believe you're close enough, but I can't give you a test, and I'm advising you to stay home. Advice from a doctor. If they get a diagnosis of COVID-19, we all know that they're going to be quarantined or self-isolated, so that would count. Or if they have they're in the vulnerable population, so they have one of the diseases that's been identified or fall within the age group that's been identified as part of the vulnerable population, and the doctor says, I'm advising you to stay home and quarantine or self-isolate. That would count also. The other circumstances where somebody could take emergency paid sick leave is the caregiver or, like I said, other circumstances. The first one is an absence for caring for an individual who is subject to one of these quarantines or isolation orders or has been advised to self-quarantine or isolate. We're going to get to the definition of individual in just a second, so hang with me. The next one is an absence for the purpose of caring for a child if the child's school or place of care has been closed. So this is how the two dovetail, the two different kinds of leaves dovetail in. This leave provides, and I know we haven't gotten to those details, but this leave provides for essentially 2 weeks of pay for the employee. And then the public health emergency leave or expanded FMLA would provide the other 10 weeks of leave. So the two can go together, even though you can't force them to use it together. The two can cover the employee for a full 12 weeks. And then there's this catch-all category, an absence because the employee is experiencing a substantially similar condition. That is to be determined by the Secretary of Health and Human Services. Last I checked, there is no such list. So if you put this on your forms, which is probably the thing to do when somebody's requesting a leave, if you have a form, they come and ask you, what does that mean? You're going to say, I don't know. We've got to wait and see if there is such a thing, but right now there isn't, so sorry, I can't give you that. That leave has to fall within one of these other circumstances. Who is an individual? Promised I'd get to that because that's a broad term. So under the regulations, an individual is a person with whom the employee has a personal relationship. And so they have to know the person, right? They have to have a personal relationship with them. Can't be the person down the street that's put a call out to get some help. And it also has to be the employee's immediate family member, a person who regularly resides with the employee at their home, or somebody in a similar relationship with whom the employee has a relationship that would, quote, create an expectation that the employee would care for the person if she or he, and that's sorry, a typo there, if she or he were quarantined or self-isolated. So it's still broad, it's still a little subjective, but at least it tells us that it's not just anybody that they're caring for who happens to have either a quarantine or from a quarantine order or a advice from a doctor. So save the best for last. How much do you pay the employees when they're in these circumstances? This is why I go through the reasons first, though, because it makes it a little bit easier to understand the pay provisions. If it's for the employee's own circumstances, then you pay them what they would have otherwise been paid. That's at $510 per day, $5,110 in the aggregate. And then for caregiver leave, it's 2/3 of pay, capped at $200 per day, $2,000 in the aggregate. So depends on which reason falls under how much you pay them. It's for 80 hours if you have a full-time employee, and a full-time employee has been defined as an employee who works 40 hours or more. It's not your employees who work 37.5, it's not your employees who work 35. It's only those who work 40 hours or more on a regular basis. Those are your full-time employees, they get 80. So that's the easy part. If they're part-time, then you have to figure out the amount the employee would work on average in a 2-week period. And that's the bucket of time they get handed to them to use if they have one of these reasons to leave. There is a variable calculation provision if the employee has variable hours, the same as the FMLA amendment or expansion, and so you look back 6 months. You cannot require an employee to find a displacement. I've not heard anybody talk about that one. No-brainer. You can't force the employee to use other paid time off first. The employees may choose to use emergency paid sick leave first, but that's their choice. There's no carryover, no pay upon separation, no interference, discrimination, or retaliation. So I can't treat people differently because they've chosen to take this form of leave. So what should you be doing right now? Or maybe what were you already doing before April 1st? But I know people are still working on this. There should be a policy or a communication to your employees about this. Some people are only using the poster and allowing the poster to be their communication. So we talked about the poster earlier. You need to have that poster in a conspicuous place in your workplace if people are still coming to work. If people aren't coming to work, you need to find a method to post it for them. And the Department of Labor has said that that would include putting it up on an intranet site, some employee portal, right? Or even your external website. It could also be emailing it to all your employees or putting it in the mail to employees. But it's important that your employees have it in a place where they are likely to see it. Forms and documentation. There is no form that's been provided by the Department of Labor. Whether there will be one in the future, I do not have that crystal ball. I've not heard a lot of talk about it, except for employers asking me whether or not there's going to be one. But the regulations contain some interesting detail about what an employee needs to provide you in order to get the leave. And I'll give you an example. There's the advice by the medical care provider, the healthcare provider, to stay home and quarantine or self-isolate. The regulations say that the employee must provide you, as one of the pieces of information, the name of the doctor or medical care provider that gave them that advice. That's an interesting provision because it says the employee provides you the name. It doesn't say the employee provides you the doctor's note. There's nothing in the regulations that say, and they have to bring in a note. It just says that they have to give you the name. Now, there's another catch-all portion of the regulations that say that you need to keep, and this doesn't apply to you, by the way, you need to keep whatever the IRS requires employers to keep to get a tax credit. But since that doesn't apply to you, you don't have the catch-all. So it's going to be important that you look at the regulations and find out what you're supposed to and can ask. And it's a lot to put on a slide. And it differs depending on the reason for the leave. But for the most part, it's a list of, their name, their reason for the leave, and the basis for the leave. So the employee's school, for example, would be one of the things that you ask for the care for the child or the employee's child care provider. So you get the pieces of information that are necessary to connect up all those dots. What symptoms they're experiencing. It's an interesting list of documentation or facts that you gather from the employee. And someone gives you a little bit of leeway. You need to be careful with that leeway. Don't ask for more than what the rules allow you to do. But for this child care provider issue with the individual who is suitable for care being there, and it doesn't count if there's another individual, suitable individual to care for the child, maybe asking questions like, is there somebody else in your home that can care for the child? If so, who? That kind of thing. For your payroll purposes, you may still want to have pay codes for this kind of leave, even though you're not eligible for, you as employers aren't eligible for this payroll tax credit. It would be still important for you to be able to track how much leave a person took and be able to show that you gave them the leave that they were required to get and gave them the pay that they were required to get. So pay code could be of interest to you still, even though you don't get the tax credit. But some kind of record keeping system in the background is going to be important so that you can show that you gave the kind of leave you were supposed to in case you're ever challenged. The regulations have a requirement that documentation related to the person's leave be kept for a period of 4 years. There's a new documentation requirement in the regulations. And if you've got a concern about how you're applying these, I really encourage you to talk to counsel and work through it a bit, because as I've said many times in this presentation alone, these are changing from day to day. Sometimes we get different guidance on it, and work with a professional who's keeping up on it so that you can get the advice that you need. I go through a couple of questions here because I think they're all very pertinent to the presentation or the discussion we just had. And so I've got a few more things that we can talk about, but I'm going to go through a few of the questions. All right. What about employees who have a doctor's slip stating that they are quarantined because it's medically necessary, right? And so that would be a reason that a person could take this emergency paid sick leave. That doesn't count for public health emergency leave. But if the employee has that doctor's slip, that's the advice from the doctor saying that they're being quarantined because it's medically necessary due to COVID-19, right? There's that little adder you need there. Then they fall within the rules related to, or they qualify for leave under the emergency paid sick leave. So there's another question about extending the leave to 2/3 pay. Remember, the 2/3 pay applies to emergency paid sick leave when it's for the care of another or that other circumstance. It also applies to the FMLA expansion, and the 2/3 pay starts applying, and maybe that's what the question was about. The 2/3 pay starts applying after the first 14 days. So there could be actually full 12 weeks if the person is caring for the child. It could be a full 12 weeks at 2/3 pay if the employee takes the emergency paid sick leave along with the FMLA leave. All right. Another question that's come up is we have a very specific question about a person who is who's pregnant, and whether that person is entitled to one of these leaves. And there is apparently another child in the family. I can't answer specific questions on a webinar format, nor could I provide legal advice. So the answers I give aren't legal advice. But to the extent that a person has the need to care for a child when that child care center is closed, for example, the young child in the house, that could qualify as this kind of leave if it happened after April 1st. So there are a couple of different ways in which a person who's pregnant also sometimes falls within the category of a vulnerable population. So there's a couple of ways that a pregnant individual or a mother that has kids at home or a father that has kids at home could fall underneath one of these reasons to leave. Has the employee, if the employee has a doctor's note putting them off of work as a precaution, but they seem healthy, or they feel healthy, is that enough for them to work from home before the end date of the doctor's note? Can they work from home and not use these provisions? So we go back to the kind of baseline rule that if the employee can work or telework, then they're not entitled to leave. As long as they have work that's available for them to do, they're not entitled to leave unless their reason for leave prevents them from working. So might feel a little circular, but you think about it. If an employee has been given a doctor's note to self-quarantine or isolate, but the employee is feeling perfectly fine, and you as the employer say, that's fine, go ahead and self-quarantine or isolate, but you can do telework, you can work remotely, giving you permission, here's all the materials to do it. There's no reason that the employee can't work then. And so there's no reason for them to actually need leave. As the doctor has said, you can't type or you can't get on the phone or you can't do those kinds of things. What documentation do we need to require from the employee to prove that they are the only suitable individual available for child care? That goes back to my comment that there's really no list in the regulation that says, this is a documentation you can require of the employee. But what it does say is that you can require information from the employee. And because the regulations have that provision about a suitable individual, you could ask the question. You could say, are you the only individual suitable to care for these children at home while they're off to school? And if you get a yes, then you've got documentation, right? I know that's a little dissatisfactory sometimes because you're trusting what an employee checks on the box or says to you on a form. And if you do happen to find yourself in a situation where you question it, I'm going to default to honoring and expecting my employees to be honest, and it would think that that's the general rule that all of you are going to apply. But if you've got a situation where you doubt that, there are always ways in which you can handle that situation. I would handle it carefully because you don't want to look like you're trying to interfere with their right to take leave. You might seek counsel in doing that because it could get you in a position where you are, you are accused of being retaliatory or discriminatory. But you could ask some questions, find out a little bit more about their personal situation, and then make a decision based on those additional questions, or do a fraud investigation. It's always been permissible to investigate an employee's use of paid leave time that's required by law if you've got a good faith basis for believing that they're using it improperly. Again, I suggest doing that only with counsel behind you, so you know that you've got some guidance that and in the way to do it the best without getting yourself into trouble. Right. So there's a question here that says, county governments are not eligible for the tax credit from what I have researched. Am I correct? I believe that is correct. County governments are not eligible for the tax credit. Public agencies are not eligible for the tax credit. You've got to be a private employer in order to be eligible for the tax credit. Another question, could someone get 24 weeks of FML, or do the leaves run concurrently with the standard FML? This is a very good question and one that I'm glad was brought up. So the public health emergency leave or expanded FMLA is part of the FMLA. It's not a brand new 12 weeks. So if the employee has already taken leave under the FMLA, that will reduce the amount of leave that they have available for caring for their child who's out of school under this public health emergency leave. So 12 weeks is 12 weeks, and if they've exhausted it for another reason, then they won't even have that expanded FMLA or public health emergency leave available to them. It would also reduce the amount that they'll have available to them in the future if they take it now for this reason. All right. I am not seeing any other questions. Can you believe I got through all of your questions? So let's talk a little bit about a few other issues that come up, and then I know that I believe one of my colleagues on the phone would like to jump in if she can, and I don't know if that'll work. Oh no, she's just giving me something to tell you all, and that's great. So okay, so So we have sometimes I'm talking to employers about the situation where they actually have somebody in the workplace that has been diagnosed with COVID-19. And so I thought it would be good to, if we had the time, to kind of review this aspect of what's happening right now. Hopefully you all have thought about this and thought about what you're going to do. Because when you are faced with the actual diagnosis, you don't want to be kind of in panic mode. You don't want to be wondering what to do and then maybe make a misstep as you're doing it. So in this particular situation, because of the pandemic, it's actually okay to ask the employee some questions. To ask them about what their symptoms are, to ask them if they've been diagnosed. Those questions are all okay. So if you've got somebody who is in your workplace who appears to be sick, asking them questions is not a problem. But you need to do it in a way that is very confidential. You don't want to violate their privacy, but this is not a situation that's covered by HIPAA. A lot of people misunderstand, I would say, what HIPAA covers. HIPAA doesn't cover an inquiry that you're making as an employer to an employee, nor does it cover what the employee tells you as their employer. So, if the employee says HIPAA, that really doesn't cover it. What does cover it is the ADA, the Americans with Disabilities Act. But if you're making an inquiry that's job-related and consistent with business necessity, you're fine. You may want to, and I encourage people who have obviously a diagnosis, you definitely send somebody home. If they tell you they have a diagnosis and they happen to be in the workplace at the time, hopefully that won't happen. But if the employee has strong symptoms of the virus and appear to be suffering from those symptoms while they're in your workplace, you're going to want to send them home also. There's a general duty that everybody take care of their workforce and take reasonable steps to make it a safe workplace, and that's what sending them home does. CDC provides some guidelines about what else to do in your workplace, including sanitizing the person's work area. If your employees have had direct contact with the employee during the 14-day incubation period or the 14 days after, then you need to consider whether, for the safety of the rest of your workforce, you need to notify the rest of them or part of them, maybe just the people that have direct contact, and you need to consider whether you need to send anybody else home because of that direct contact and concerns about spreading it in the workplace. Always remember privacy and confidentiality, and rely upon your health departments to guide you in this regard. So if you find yourself faced with this situation, make sure you thought it through. The people who are responding to employees who report things like I'm sick, make sure they know how to handle the situation. So I've got a couple of more questions, and I think I've got a few more minutes. Let me see if I do here. Let me check my time. So we've got a few more minutes. Let me see if I can get a question or two answered. There's a question about whether the county should amend their personnel policies for this particular mandated benefit. And what I would say is, if you want to communicate to your employees kind of the rules that you set up for how to request leave and what information they need to give you and those kinds of things, it's valuable to actually communicate that out. And if it's a policy piece, because the poster doesn't do quite enough in that regard. It just kind of outlines the reason for leave and how much pay a person can get. If you want to make sure that your employees know how to do it under your guidelines, right, what information they need to provide you, it's best to communicate a policy. You need to amend your actual personnel policies. Well, it's a temporary situation. It will go away on December 31st. So it may be a side policy that you have that just applies during this particular waiting period. We had some questions regarding whether the, let's see, I think I answered most of these. Is there a 10-day waiting period for use of the expanded family medical leave? It's not actually a 10-day waiting period. They're using it during those first 10 days. It's just unpaid. So think of it more like the traditional FMLA that's unpaid. they're using it. There's just no pay attached to it. So they could use whatever personal time off you have available to them. They could use this emergency paid sick leave that they have available to them during that time frame. Just so you all know, this is sometimes I'm hearing, because there was so much talk about the CARES Act, I'm hearing employers calling all these programs the CARES Act. This is not part of the CARES Act. This is part of the Families First Coronavirus Response Act. So to the extent that that's been confusing to you, I just wanted to let you know. So we have governmental entities currently won't be eligible for the tax credit. Can we increase the 66 and 2/3 pay without jeopardizing any future changes to eligibility for the tax credit? I don't know that there will be future changes to the eligibility for this tax credit because as taxing agencies, there's not typically a tax credit available. But you are permitted to pay what you feel is right to pay under your policies and what you have the authority to pay under your policies. You just won't get a tax credit. So you could pay more than what the law requires. You just can't pay less. So we have, I think we've gotten through most of this. I told you one of my colleagues was on the phone, and I wanted to convey a message from her. Lisa Lee is on the phone. She's with ICE Miller, and she's available for follow-up questions also. And to the extent you need some guidance or help with your policies or forms, we can help you with those. So just let us know if you need assistance in that regard. And I just got one more question in, so I'm going to go ahead and answer that too, since we have a couple of seconds here. Can an employee supplement the 2/3 pay with the PTO? And the answer to that is yes, that is something that you're permitted to let them do. So that's your choice, whether you permit them to supplement and allow them to then move their pay up to 100% pay. All right. And we're getting a few more questions right now. Can the employee receive 10 days of paid leave while we're waiting a medical diagnosis, receive a positive diagnosis on 10 days, and get 10 days more? No. So once the emergency paid sick leave is exhausted, it's exhausted. So under the law, you're not required to give them more. It's a one-time. Well, I don't want to say it's a one-time shot. So it's a one-time bucket. Let's put it that way. So if you've given your employees have access to 80 hours. The employee takes 1 week off, that's 40 hours, and then is able to come back, for whatever reason that works out for them. They could use the 40 hours, the remainder of the 40 hours, the next time they have a qualifying reason. But once the whole 80 hours is gone, the 80 hours is gone, there's no more time for them through December 31st, it's gone. And if you want to give them leave beyond what is required, you can do that. That was a question that came up also. So both leave beyond what's required or pay beyond what's required is permissible to do. You just have to make sure that supports with your other personnel policy practices, and that you give that consistently and equally to your employees. I think I have covered everything, and we are 2 minutes out of our time unless somebody slips in another question here. I really appreciate the time that you've spent. I know a lot of you have hung on the entire time frame. I hope that I was able to answer some of your lingering questions. And again, if you have some follow-up questions, like Lisa asked me to tell you, she's available. And if there's other things that we can help you put together, we're here to assist you and happy to do that. I know that the association is also helping provide each of you with a lot of information and doing a great job at getting the information out to you through videos and things like that. So we appreciate the partnership with the association and appreciate having this time to spend with you. So thank you very much. Stay safe, be healthy. Talk to you all later. Bye.